Welcome back to WMBC News. Sports, car accidents, and falls, they all have one thing in common. They cause concussions. Joining me today to discuss and bring awareness to this really important health issue is Dr. Babar Sultan. He's a board-certified physician specializing in family and sports medicine. Dr. Babar, thank you so much for being here.
Absolutely. It's great to be here.
So what is a concussion and what are some signs and symptoms of a concussion?
Concussion, it's basically whenever you have a jarring of the brain inside the skull, where the brain moves from one side to the other. That leads to stretching of the neurons inside the brain, and that's what a concussion is. It does not produce any changing on imaging studies, so it's often defined as that it's more of a functional injury as opposed to a structural injury. And some of the common symptoms that it produces include headache, nausea, vomiting, blurry vision, loss of balance, anxiety, and even some emotions. Those are some of the common symptoms of concussions.
There's always this misconception that concussions are caused by a blow to the head. But that's not always true because the upper body can be involved.
That is correct. The concussion does not always have to have head trauma for you to have a concussion. As a matter of fact, a number of concussions occur without any head trauma. As long as it leads to that jarring of the brain inside the skull, it can lead to a concussion. And one of the most unique concussions I've actually ever diagnosed was in a student that his fellow student pulled out the chair from underneath him. He landed on his bottom, but apparently that was enough to cause the jarring of the brain inside the skull and led to the concussion.
And, how do you prevent concussions?
So the only way to prevent concussions is to basically reduce the occurrences where you would have injury that would lead to jarring of the brain. Other than that, there has not been anything that's been proven to reduce concussions.
Now, helmets, there's this misconception about helmets that it can prevent concussions.
That is correct. So that's one of the common misconceptions that we see, that helmets prevent concussions. In fact, there's no evidence that any helmet prevents concussions. Helmets were actually designed to prevent skull fractures, and they do a great job of preventing skull fractures, but they do not prevent concussions.
But that's not to say not to put helmets on, because they do have some benefits.
Oh, absolutely. As we were talking about, they're designed to prevent skull fractures, and I can't recall the last time, a professional athlete who was wearing a helmet had a skull fracture. So I'd say they're doing a great job of that.
How do you heal a concussion?
The true and tried way of dealing with concussions has been cognitive rest. And cognitive rest involves stopping any activity that would lead to stress on the brain. That would include being in environments where you had a lot of stimuli. For example, going and watching a movie where your eyes are moving throughout the screen, where sounds are changing in both frequency and as well as intensity, i.e. loudness, or when you're trying to do anything mentally intensive. For example, an accountant trying to do taxes, would be mentally intensive. And of course, stopping all physical activity. But there's some new research that shows that a certain amount of physical activity may actually promote the faster healing of concussion. However, that research is still coming out, and we haven't clearly understood exactly what impact exercise has on the healing of concussion. So for those of you guys that are watching, do comply with the restrictions that your doctor puts on you.
How soon after a concussion can one resume normal activity?
It varies from concussion to concussion. Basically, the current standard of care for concussion is to stop all activities that would provoke the symptoms of concussion until all symptoms are resolved. And at that point, you slowly start introducing more and more activities to see if the patient can tolerate them. And that's where the state-regulated return-to-play program comes in, where you do less activity on one day, more on the second day, more on the third day, until the athlete is introduced back into full activity.
And what's the first thing one should do after a concussion, immediately after a concussion?
That's a very important question, and that's where the old thought used to be that, if the athletes were tough, they could, toughen through any injuries. Concussion's not one of those. And, that's where the mantra is changing. More and more athletes are learning the impact concussion can have on long term, and they're starting to basically take it seriously. Going back to the question, the first thing that one should do is stop all activities that can provoke symptoms. Going back to the things that we talked about, including mentally intensive activities or physical activities that that can lead to those. And going back to that more and more athletes are realizing the importance of it. I was actually watching an NFL preseason game where one of the athletes got a concussion, and his fellow athletes got the attention of the sidelines and pointed towards the athlete that he needs to be pulled out and evaluated to make sure that he is safe to return. I hope that catches on with our high school athletes as well, and as well as the general public.
That's a great example. Any last minute thoughts?
We've talked about concussions and some of the newer research that's going on out there. One thing that I can recommend to all my athletes is follow all the rules. The rules are in place to try to decrease some of those concussions, report any symptoms that you may have. It's important to sit out for a couple of weeks if it means that you're going to prevent any lifelong neurological deficits.
Thank you so much for your thoughts. Dr. Babar, thank you for being here.
You're welcome.
WMBC News will be right back.